everyone. Welcome to our
Hello.
weekly gathering where we make it okay to talk about all things menopause. We cover the clinician and medical side, lifestyle and nutrition and exercise, and also the emotional, mental health, and real side to all of this. I'm Melanie Olson. I'm the community director here at Gennev, and I'm going through perimenopause. So we're all going along this journey together. Oh, there she is. Jill just joined us. Jill, welcome. Everyone, today is a special day. It's Menopause Awareness Day. At Gennev, it's Menopause Awareness Day every day. We really believe that, but we wanted to take this opportunity to come together and do what we like to do best. Talk about menopause, how it impacts all of us as women or people with ovaries, how it shows up at work, and then talk about the holistic Gennev patient model that we offer to our patients that's effective, compassionate, personalized, and ever evolving to their needs. Our goal is to make you feel awesome again, not just a little bit better. We can help you. Today, we have three incredible Gennevers joining us. We've got the founder and CEO of Gennev, Jill Angelo. We've got Gennev's Chief Medical Officer, Dr. Rebecca Dunsmoor-Su. And we also have one of our talented Gennev registered dietitians and menopause health coaches, Monika Jacobson, joining us as well. I'll do a little more on the speakers because they're all so amazing. And I just want you to know more about each of them. Jill started this organization 5 years ago and has never looked back. She's truly poured herself into the advocacy, awareness, knowledge that was so lacking in this industry. And she knew she needed to help create lasting and impactful menopausal care, treatment, and support to all going through the various stages of menopause. Jill is an incredible person, a passionate advocate for women's health and wellness, and a wonderful leader. Jill, we're so happy to have you join us today. And then Gennev's Chief Medical Officer, Dr. Rebecca Dunsmoor-Su, expertise in women's health began in residency training in obstetrics and gynecology at the University of Pennsylvania. Her experience as director of menopause at the Swedish Menopause Clinic fueled her pursuit and passion and expertise around women's health. She's a mainstay in this industry, someone other doctors and clinicians learn a ton from and greatly respect. We all do. Thank you for joining us, Chief Medical Officer at Gennev, Dr. Dunsmoor-Su. And then last but not least, we have Monika Jacobson. Monika, a talented and accomplished registered dietitian with over 15 years experience coaching women on their health and wellness journeys. She helps women thrive in menopause and offers support and accountability to her patients with an individualized approach. Whew, that was a mouthful. Thank you all, and welcome to all of you. It looks like Jill's having a little bit of trouble, so she's going to be popping back in. So moving back into our conversation and start, and audience, just a quick little reminder, please put your questions into the chat. If you've got any wonders, curiosities, questions that are nagging you, throw them into chat. We will get to them either throughout the broadcast or at the end. We'll start then with you, Dr. Dunsmoor-Su, to share a little bit more about the holistic approach to patient care at Gennev and what that really looks like from your point of view.
I love to talk about this, Melanie. One of the most thrilling things about working with Gennev for me is I get to design medical care the way I wish I could always do it. I worked for 20 plus years in traditional OBGYN and really knew that while I have a lot to offer my patients and I can explain menopause and I can educate and I can treat with medication, that menopause is a global thing. Our physiology changes, our bodies change, and being able to address all of those things for a woman is how we really make her menopause better. And, every woman is very different in how she experiences the menopause. Every woman has different panel of symptoms. Every woman has different needs and different health risks. And working in a collaborative way with our RDN health coaches really allows us to address all the needs of a woman I can provide the medical side. They really provide the lifestyle change that gives a sort of overall global approach to that menopause. And when we focus on menopause, we don't just focus on the symptoms and what's going on right now. What we focus on is how are you going to live the next 40 to 50 years of your life? And what health issues do we need to think about and help you to address proactively so that those are a great 40 to 50 years?
Yeah, that's really that really is the question to ask yourself. What do you want the next 40 to 50 years to look like? What do you want to be able to do, right? It's incredible.
Exactly.
Mm-hmm. And together, on that individualized plan that you create and you bring that to the patient, how do you approach it that maybe the first time they come to you?
So the very first visit with any patient is about sort of centering ourselves in where she is in her transition to menopause. Is she perimenopausal or menopausal? But also getting to know that patient and what her health goals are, right?
Mm-hmm.
So some patients are coming to us because they have severe symptoms and they really just need treatment for those symptoms. And then maybe at that next visit, we can address some of the longer term issues. But some patients may already be on hormone therapy or have a treatment going for their symptoms, or their symptoms have eased. And they're really coming to us because they realize now they have to think about these health issues long term. And they want to chat with us about, well, what can hormones do for me in terms of health issues, or what are some other options? And that's when we get to dig sort of deeper into the meaty part of the rest of your life.
Yeah.
I always say, every woman experiences menopause very differently. So that first visit's about centering. How do I get to know this patient? What are her needs? And how do I best help her to manage those?
Yeah, absolutely important. In the community, it's so important to go in there for me because I realize I'm not alone going through menopause, but that many things are changing and shifting. There's a lot to this conversation around, well, I was doing well for this amount of time, but suddenly this is happening. And so it's that shapeshifter menopause reality that is interesting to kind of watch. And I bet you see that a lot meeting with the patients.
Absolutely. And patients, especially that I've seen for several years now, we touch base. And once someone's fairly stable on their treatment regimen, I may only touch base with them once a year. But in that touch base, always something has changed and there's something new to talk about. And that's why I really appreciate sort of this long model where I also hear a lot from our RDN partners. If they're working with someone a lot more frequently than I do, they may come to me and say, hey, this patient that we share is experiencing this now. Should I have her come and see you? What do you think we should do? This is, where we're going with that.
Yeah. And Monika, jump in with that. I mean, so you and the doctors have a really special relationship at Gennev, and like Dr. Rebecca was saying, move back and forth. It's a team of people who are coming to help serve and help you. Can you share a little bit more on that lifestyle side?
Yeah, absolutely, Melanie. Well, I think we just have such a unique model at Gennev where our patients often see the OBGYNs first, and then the doctors will refer to us dietitians. It doesn't all, you can always come see us first, but often what happens is they see the doctors, and then after that initial conversation, sometimes the second conversation, it's really clear that this patient would benefit from coming at their menopause journey through that lifestyle lens. And, we're a team of registered dietitian nutritionists, which people may think of first as like food and nutrition. But the cool thing is that we're always looking through that nutrition lens and considering the whole person. So what I mean by that is the food that you put in your body, the fluids that you put in your body each day, or that you don't, that's all impacted by how you move your body, where you're at in your menopause journey, your stress levels, how your anxiety is, how you feel about your changing body, and your sleep. So we're really thinking holistically about all those little factors, big factors really, that play into nutrition. So we're not there just to hand over a meal plan and send someone on their way. It's really about getting to know what makes them tick, and then finding like a practical and realistic, sustainable approach to nutrition and other lifestyle that they can really continue on out. And I think the nice thing also about like having this ongoing rapport with our patients and typically a more frequent cadence of appointments with our Gennev patients compared to the doctors is that we just get to see them more frequently. So they might say, well, I'm having all this breakthrough bleeding, and I didn't have that when I talked to Dr. Rebecca like 2 months ago, but now they're having this. Is that normal? Or this is how I'm feeling on this medication. Is that normal or not? And we troubleshoot that. We talk with the doctors, and we pass them along and back to the doctors as needed. So there's just all these touch points, I think, that really enhance their overall experience.
That's so important to talk about. Yesterday, I was talking to a patient, someone that Gennev has been treating ongoing, and she's getting the help and support she needs. She's doing well. And she said that it felt like a team, and it still feels like a team. And that is how we do approach it. And it was really powerful to hear that directly from her. And another woman, just like me, just like all of you, going through it and getting the help that she needs and totally thriving. That's super cool. Question for you, Dr. Rebecca. What is it like? So many of the people that come and see us, we're a telehealth clinic. You know, they may have already a doctor that they're dealing with or working with. Can you talk a little bit about that intersection, that relationship?
Absolutely. So it's really key for us to have collaborative care with the patient's physicians, right? Because we are telehealth. There are certain things that I cannot accomplish for that patient. I am not going to be able to do her pap smear. I may not know the doctor in her area that does colon cancer screenings. So I want her to have a good and solid relationship with either an in-person primary care provider or an in-person gynecologist who's local to her. She's coming to me for specialized menopause expertise, and I'm going to share that expertise both with the patient, but also send my note on to her local doctor so that everybody is kept in the loop about what we're doing and why we're doing it and what risks and benefits have been discussed in that process. That way, if our teams are all working together, we can provide that patient the best care.
That's excellent. Very, very important. And just another little plug on getting specialized care. You know, you may have a wonderful, wonderful relationship with a doctor, but just me now being a patient of Gennev and going through it, it's a different story to work with someone who knows menopause, an actual expert.
This is really critical, Melanie. You know, they've done studies that show that even in OBGYN residencies, those of us who should know women's health particularly well, 80% really get no formal training on menopause. So you can only imagine that for primary care residencies, either internal medicine or family medicine, like it's probably even less. And it's not that your doctor isn't intelligent and wants the best for you. This just may be an area where they are not specialized or do not know. If they do, then great, you don't need to see us. But if they don't, let us provide that specialized consultation and work with your physician to best care for you.
Absolutely. Jill, welcome. Thank you for coming. Sorry that you got stuck. And are you actually in a spaceship or are you in an airport somewhere?
It does. You know, it looks like I'm in a spaceship, and I feel a little bit like I am if you saw everything around me. But, you know, thank you for your grace and patience as I rushed. I'm in an airport lounge. And, you know, I think probably like so many women that we support, we're all juggling a lot. And sometimes things don't go as planned. And I came in hot to this presentation, but I'm so happy to be here. So happy World Menopause Day.
Absolutely. Happy World Menopause Day. Thank you so much for joining us. Really, Jill, you know, you represent so much awesomeness, and it's such a wonderful person. I love working at Gennev and having such an incredible leaders at Gennev. But I was wondering if you could talk a little bit with us on some of that generalized Gennev, who we are, and then how menopause impacts the overall world, both personally and professionally. We're really focusing a lot on women at work. All of us are women working. And so would love for you to touch on that, if you could.
Yeah, absolutely. You know, I think just overall, Gennev is a national virtual menopause clinic. And our team of obviously OBGYNs and dietitians, we provide comprehensive specialty care for women who need this kind of care as they go through this transition in life. In addition to overall menopause care, most recently, we've added behavioral health care. We know it's important for a woman to get her comprehensive medical, lifestyle, and behavioral health care during menopause from one location. Near and dear to my heart, when I started the company, I had a mission to change workplace benefits for women going into this transition in life, or people born with ovaries. And so we're starting to see those changes happen now for working professionals, for dependents of working professionals that need the kind of medical care as they go through this time of life. And it's just really rewarding. I was mentioning earlier today to a part of the team, I've been in this business 8 years, and this year, World Menopause Day feels, the conversation feels louder, and more people are having it, more workplaces are having it, and that's just a bonus for all of us.
Oh, that's so awesome. Yeah, what an incredible comparison when you first started.
Absolutely. And I think in the early days, I know Rebecca and I have certainly felt this. There are many moments, obviously in this business, where we felt that we were the only ones talking about menopause. And it's not something you'd want to talk about, or people didn't want to hear about. And things have changed so drastically over time. And that's such, again, a benefit around the education that's out there, and the care that every person's entitled to and hopefully will receive. For me personally, as a woman in perimenopause, and I say that here in this airport lounge, it's not something we all want to always say, and yet it's a reality of life. And so the more that I'm caring for myself, to give myself the energy to smile and be upbeat about this every single day, is important now for my quality of life. But long term, as I hear from our care providers, and Rebecca, you talk about this all the time, how do we avoid hip fractures in the future and hypertension? The care we give ourselves now is so imperative for the future. And so that's also kind of a double down for my own personal health that I'm thinking about every day when I work with my health coach at Gennev, as well as my physician.
I was actually going to point out that our health coaches are kind of critical in that, because a lot of the things that we need to do in our 40s, 50s, and 60s are what's going to impact our 80s and 90s in terms of maintaining our bone health and maintaining our cardiovascular health. And a lot of that has to do straightforwardly with our diet and our exercise and our stress management. And that's why the registered dietitian, nutritionist, health coaches are so critical to what we do at Gennev.
Oh yeah, it's so important.
Yes, thank you for saying that. I mean, I of course echo all of that, and really just believe that in the depths of my being. And it's so powerful to see people come work with us who are feeling like, what is wrong with me? My body is changing. I don't feel the same anymore. Is this going to get better? And I think we all hear that, and everyone's experience is really unique. And I think they often come to us after, unfortunately, being dismissed by other healthcare practitioners of many kinds. And they come to us, and so many of them feel that relief so quickly. And they get to see us usually within days. And that is so unique, I think, with our telehealth model, that it's not like you have to wait months and months to see the specialist you were referred to from your primary care doctor. You can come to see us and have that conversation so quickly, find relief quickly. And a lot of that's coming from both the doctors and the dietitians. So again, just kind of speaking to that team approach, and just the haste that we can really make change in people's lives.
One thing I want to add on, Monika, to what you just said, that I think also is unique about the team, particularly that you're on as a registered dietitian nutritionist. You're doing double duty. You're a dietitian, you're providing clinical lifestyle care, and you're also providing the coaching services that so many women need. Our coaching at Gennev are clinicians. They're, who are practicing evidence-based care in nutrition and fitness, and then working obviously in partnership with Rebecca and her team, the physicians. But I think that's just really magical, because when I work with my coach, which I work with Coach Stacy Kazanchuk. She not only checks in on me from just a coaching perspective, but she's also reminding me then about some of the physiological things that I'm working on, or the things I want to be mindful of, nutritional things. When I talk about energy and lack thereof, she's giving me real tangible, planful tips and recommendations. And then she checks in on me. So it's this perfect combination of dietitian and health coach care that I get from her that I trust. And it's all from one person.
Yeah, I love that too, Jill.
From Katie on the RDN team, the registered dietitian, same exact experience. She's so great. We can't say enough about this, but it really does help me as a woman in peri to stay focused, to do those little things that, and it's not little, some's big, some of it is big, but a lot of it is just those little things, just kind of keeping it all and doing it. And it makes such a difference. And the care just feels really good too. Getting checked in on someone who cares, someone who cares about me, that's powerful. That's really powerful.
Yeah. And I think a lot of what we hear is women, especially, and people born with ovaries are often caretakers. They're caring for their families and for, sometimes it's aging parents or children across all ages, young children, and sometimes children who've already left the nest. They're dealing with their own relationships, their professional lives, lots of giving, lots of outpouring of their energy. And so for a lot of people, this can be the first time in a long time, or maybe ever, that they've invested in themselves and their own health. And we make that okay and encourage, and it absolutely has to be like how we change. And I think bringing menopause into the forefront, especially as it's really just boomed in the last several of years, I think people are hearing that. They're on board with it, and women are ready to do that for themselves. So we've got all of your backs, and that's what we're here to do too.
That's so important. We did get a question about this, and I'm gonna pivot this to one of you. So it's Edie Greenberg. She said, "I've noticed that this topic is much more popular this year, menopause. Woohoo! I'm curious to know why it's gaining more attention in the US, and it looks like the UK is ahead of us with workplace policies."
They are. I would love to think that it's more popular this year because those of us like Jill and I who have been yelling from the rooftops for years are finally being listened to. That probably has something to do with it. But I think the more important reason is we are women in our 40s and 50s going through this, and we're at the top of our game. We're leaders in organizations now. We are saying to our organizations, it's not okay to ignore this. This is important, and you have to treat it. And you have to give me benefits to treat it, because I'm important to this organization, and so you need to give me what I need. And I think just this generation of women coming up in power within workplaces has made a huge difference. What do you think, Jill?
Yeah, that's absolutely right. The decision makers, I think, that are starting to bring this into workplace benefits are women just like us. They're sitting at the table, making the decisions. They're doing what's best for not only them, but their constituents within the companies and the employers that they support. But also, I think there's been a rise of menopause companies, and whether it is clinics, whether it is products, whether it is community, that's a good thing. It's a good thing not only for people going through menopause, but it's a good thing for all of us, because it's a rising tide floats all boats. And Edie, you're absolutely right. The UK has been ahead of us for years, and good on them. We have a good role model to follow. They're instilling workplace policy in workplaces and making it a standard, just like in the US when fertility benefits have become a standard, almost mandatory in certain states. Menopause is going to follow that same trajectory. And I think we all just let's jump on that train and make that happen, because it's coming and it's here. And I really appreciate our friends in the UK just, forging a path that we can mimic and follow.
Yeah, no doubt. Yeah, and if you needed it, here's your permission to shout from the rooftops. I'm in perimenopause. I'm in menopause. I'm going to talk to my benefits manager. I deserve this kind of care, this essential care for me. And anyway, if y'all needed that permission, there you have it.
Can I just add one thing about what you were saying, Jill and Rebecca, just about how the growth of this industry really in the last several years. We hear a lot of patients come to us with so much confusion. I've seen this product on Instagram, or I've heard about this way of eating, or just all sorts of noise, all sorts of misinformation about there. We all know that. Well, I hope we're learning that is totally the case. But what we do as a team of registered dietitians and of course all of our doctors is we share the information, we share the truth about what is evidence-based, what the science is telling us, and we are constantly figuring out, for example, spend your money here versus there. Don't buy this supplement, do this. And I mean, there's a time and a place for all of it, but we really help bring truth and shed light on what's legit, because I think it's really it's become a money-making industry for sure, and we're here. That's not what we are trying to do. We are really trying to bring the evidence-based information to people who really need it, and so that's always the approach we're taking.
I think whenever something starts to hit the news and become popular, then people look at it and go, hey, I can make a buck there. You know, I think what leads us as Gennev is we are a menopause clinic. We are clinician-led. We focus on the medicine. We accept that there are lifestyle and dietary and other interventions that can be highly effective. We're not only focused on medications, but we are always taking the lens of, this is what we know about the physiology of menopause. This is what we know about the science around menopause. This is what we know to be safe. This is what we don't have information on. And we share that information with patients because empowerment is what we're about.
I think, to add on to that, particularly back to Edie's question around the workplace and why is this becoming more popular? One thing that you're also seeing a lot of companies like Gennev who are working with employers provide beyond the clinical care is education. It is education not only to people going through menopause, but also managers. How do you work with someone who might have to take a leave or might not be able to work in the mornings because she struggled with sleep at night? Making them aware of their constituency and what they might be dealing with. And then also education and training for HR managers and benefit managers. This is a first for all of us. And so helping bring everybody involved along the journey is something that's very crucial. Gennev provides those educational services. I know, Rebecca, you've done some pretty fun live webinars with women in the workplace around Ask Me Anything, which get pretty candid.
And they really do.
Yes. But it's great that it's a comfortable space to have these really open conversations and in the workplace. And it's just wonderful because it's super empowering to the people that are finally learning something.
Yeah. I actually was talking to someone recently, and she's actually over in the UK, and she is part of an employee resource group for her company, and she's a menopause mentor. And as part of they get the healthcare benefits, but they also get emotional benefits. She meets with them once a month. They have this really great, wonderful program to provide this additional support for this group. And it's not the only ERG they've got. They're doing it for others. They're pinpointing and providing the necessary support and help to their constituents, as you were saying. So it's powerful.
Yeah, and we love to do that. With our webinars, we can talk to employees, we can talk to HR, we can talk to the benefits managers. That support is really critical.
Yeah. Well, we're already out of time, unfortunately. We've had such an amazing conversation. It goes so fast. Edie wrote, Gen X women in the US are leading the way, ! I totally love that. Thank you all so much for joining us today. Thanks to our guests, Jill, Dr. Rebecca, and Monika. You're all amazing and such a wealth of collective knowledge. I so appreciate you spending your time with us this morning. Next up, on October 25th, we will be going live on Facebook and LinkedIn again with Gennev Dr. Yakisha Dooley to talk about breaking up with the myths of menopause. So talking about what Monika already brought up, there are a lot of myths, and Dr. Dooley is going to be on. And so come and ask your questions. She will provide great answers for you as an MD menopause expert. And one last thing, I'm here to remind you, you don't have to suffer through menopause alone. There's a fantastic Facebook community called Menopause Solutions by Gennev with over 8,000 members discussing experiences, comparing stories. We're moderating it along with the docs and the dietitians to bring accurate information to the forefront. As you heard here today, there are real medical treatments, real great expertise to tap into to help you find your new normal, your healthy happiness, and to really lean in and empower yourself to create an awesome second part of your life. Go to gennev.com to book your appointment today. We have doctors in all 50 states and dietitians in all 50 states and health coaches in all 50 states, and you can get connected usually within 3 to 5 days. That's it. Any last little quick final words of wisdom, all?
My last word of wisdom is, if you're having symptoms, if you just want to understand your physiology, you're worth it. Take the time, make an appointment, and take care of yourself.
Yeah. All right.
I'll add one last word of wisdom, and this comes from my coach and dietitian. When you are coming in hot or having a tough day, just stop and breathe. And I did that right before this webinar because I was like late and I couldn't get my audio to work. And we all have those moments. So remember to just stop and take a deep breath. It just changes the dynamic. Happy World Menopause Day.
That's so
Happy World Menopause Day.
Happy World Menopause Day.